Hi, my name is Justine and I'm a midwifery student in this practice. So the nurse told me that you would like to discuss maternity 21 plus test that you heard about from your friend. We do offer that here, but let's talk about your individual circumstances and family history first. So based on the health history that the nurse obtained, I formulated a 3-generation pedigree of your family and their health. And it appears as though there are some health conditions that are of particular reproductive interest within your family, including Down syndrome, neural tube defect, which is in this case spina bifida, SIDS, and preeclampsia. Some of these conditions are screened for with this test that you're inquiring about. And I also see that you're 10 weeks and 4 days pregnant. Congratulations. And I also see that you're 38 years old. Is that correct? Okay, good. The test you're asking about is a prenatal screening for trisomy 21, which is also known as Down syndrome. It also screens for trisomy 18 and trisomy 13. Those are less common trisomies. And you also can test for sex chromosome aneuploidies, which are basically just sex chromosome disorders such as Turner syndrome, if you've ever heard of that. And then it also tests for microdeletions, which are basically gen mutation disorders. It's important to understand that this test, it doesn't screen for all disorders, but it tests for those that are most common. And I have a pamphlet I can give you that describes exactly what is included in this test. And you can, with this test that you're asking about, you can select different variations. So if you just wanted to do the Down syndrome and the other trisomies, you could do just that. You can add on the sex chromosomes and you can add on the microdeletions. And in addition, you can also find out what the gender is of your baby if you would like to know. However, this test is generally not used for finding out the gender of your baby only. It's more for genetic testing purposes. So the way this test works is it's performed using cell-free DNA in the maternal circulation. So basically what that means is it's a blood test that we do on you. It's no more invasive than a needle stick or a poke in your arm, just like when we have drawn your blood in the past. So, and it's also important for you to understand that there's a difference between a screening test and a diagnostic test. So this particular test is a screening tool that determines if you are at a higher or a lower risk for having a baby with these certain anomalies or genetic syndromes or aneuploidies. But it is not a diagnostic test, so that means that we can't actually confirm or diagnose that a fetus has any abnormality with this test. So basically, it's important to remember that, it can potentially have a false positive, which means that it would falsely tell you that you are at a high risk, or it could give you a false negative result, meaning that the baby could have an anomaly and it's a false negative or falsely reassuring. And again, it does not test for all genetic syndromes and aneuploidies. So in the event that you do choose to be tested, because this testing is optional, it's not something that is routine that we do on everybody, it's an option that is given to you to decide if you want to do this test. But in the event that you do choose to be tested, please know that a positive means that they have evaluated your risk and they have shown that risk to be higher, but it doesn't mean that your baby is for sure diagnosed with this condition. And then we would discuss different options for more thorough and potentially more invasive tests should this something come back as a higher risk or as a positive. So it's really important for you to weigh the benefits of obtaining this information with the potential emotional and physical risks of testing. So you have to decide, is it important to, it's important for you to consider what these results will mean for you and your partner. So it means that you will need to decide how this is going to affect your decisions going forward. And if you would opt for those more invasive tests down the road, such as amniocentesis, which is a needle inserted in utero to get part of the amniotic fluid, and there's all kinds of different kinds of invasive testing that we can talk about if we get to that point. But just know that it opens up a whole new can of worms, and you have to decide if having this information is valuable for you and your partner. Now, another thing to consider is your risks and also insurance coverage. Because age 38 is considered advanced maternal age, your insurance is probably likely to cover this test, but I can't exactly confirm that. And you do have a relative with Down syndrome, but it's not a first-degree relative, so this may or may not encourage your insurance company to help cover this test, because those are a couple things that increase your risk for having an abnormal result come back. So this test may require pre-authorization through your insurance, so it's important to check with them before moving forward so that you're not left responsible for a large amount of the cost. I can give you a phone number and information of the company who will help you check your insurance and see if they do or do not cover, and also if they do not cover it for some reason, which I believe they would because you do have a little bit of an elevated risk. This company, they help guide you to understand what costs you would be responsible for should your insurance not cover it. So even though this screening is thought to be more reliable than earlier tests that were similar to it, we would still need to discuss those invasive diagnostic testing procedures to potentially confirm a screen positive result if that would occur. So just keep that in mind. And I also want you to know that it may take up to 5 to 7 days for the sample collection to come back, sometimes shorter, sometimes longer. And then we would receive the report, and we do call all results for genetic screenings at our practice. So you can expect a call from us whether it's positive or negative. So I don't want you to be surprised if you see our number come across your phone. And I know you had also mentioned that you were concerned about spina bifida as you had a relative with that condition, and this test does not screen for that. However, we can offer you an additional second trimester ultrasound screening and or a maternal serum alpha fetoprotein, which is a screening for fetal structural anomalies, which includes neural tube defects, which would be the spina bifida. But that test would come later, though, just to ensure optimal screening. We usually do that a little bit later. So tell me, what questions do you have?